Hi, my name is Natasha. I'm gonna be your nurse today.
All right.
Alright, so I'm gonna go ahead and just wash my hands, provide privacy first. I'm gonna go ahead and wash my hands. Okay, that's for 20 seconds. Now I'm gonna just verify your name and date of birth with your wristband. Can you tell me what that is?
Akash Pramar 23-1990.
Okay, and now I'm gonna verify on the computer that's the correct information. Okay, and then I'm also gonna verify your MRN number on your band with the computer. Alright, and do you have any allergies?
No.
Okay, computer says there's no allergies, and there's no allergies on his band as well. Can you tell me where we are today?
The hospital. For
Hospital?
my exam.
For your exam. What kind of exam are you doing today?
Physical exam.
Physical exam? Okay. Do you know what today's date is?
Yeah, March 30th.
Okay, and can you tell me what the year is?
2025.
2025, perfect. So while I was talking to him, I see that you are, your airway is patent, you're breathing normally, and it looks like your circulation is pretty okay. The aides did the vital signs, so just looking at the vital signs that we have here, your blood pressure is 120/80, your pulse is 75, your respirations are 17, your oxygen is 99, and your temperature is 97.6, so everything looks normal and great so far. So for today's health assessment, what I'm going to do is I'm going to check your neurological cranial nerves. I'm going to check your cardiac, your mobility, along with your gastrointestinal system, okay?
All right.
Do you have any questions before we start?
No.
Okay, perfect. So the first thing I'm going to do is your cranial nerves. Oh, before I get there, do you have any pain today on a scale from 0 to 10?
No, 0.
Okay, perfect. So for your cranial nerves, the first one we're gonna do is your optic. So we'll do a Snellen chart. That's where we're just gonna check your eye vision, okay? The second thing we're gonna do is your abducens, trochlear, and oculomotor. So with that, I just need you to stare at this pen, tip this pen, and you're gonna follow it, okay? I'm checking the 6 cardinal points for any jerky eye movements or nystagmus. Everything looks good, you followed that perfectly. Then the next, I'm going to do the vestibulocochlear. So with that, I'm gonna stand behind you and whisper a word in each ear, and then you just let me know what I say.
Green. Orange.
Perfect. Okay. So next we're gonna do facial. Can you smile for me? Perfect. Frown. Show teeth. Lift your eyebrows. And puff your cheeks. Perfect. That seems to be intact. Then for your hypoglossal, what I'm gonna do is I'm gonna take a tongue depressor. Pretend this is that. I'm gonna have you stick out your tongue, and then I'm gonna check your gag reflex. That looks good. For the next one is your hypoglossal. So I'm gonna have you stick out your tongue and move it from side to side. Perfect. That's intact. And then for your that was your glossolaryngeal and your vagus. Did your hypoglossal. For your accessory, I just need you to shrug your shoulders upwards and then look from left to right. Okay, and then for your trigeminal, I'm gonna ask you to close your eyes, and I'm gonna touch you with something. You just let me know what area I'm touching you.
All right. Left forehead. Left cheek. Left chin.
Perfect. You have your sensories intact. Now I'm gonna ask you to keep your jaw closed as tight as you can and don't let me open it, okay? Perfect. That's intact. And then I'm also going to check your blinking reflex. So I just need you to look straight ahead. Don't do anything. All right. So I stroked your eyelashes and you blinked perfectly fine. So that is also intact, okay? So all your cranial nerves are looking good. So next we're gonna do your mobility, all right? So for mobility, I'm looking at your neck and your head. Everything seems to be aligned. I don't see any hunchback. I don't see any curvature of the spine. Looking at your skin here, I don't see any discoloration. I don't see any masses. Is there any tenderness here?
No.
Okay, I don't see any deformities or anything like that. While I'm here, I'm also gonna check your pulses. So I'm gonna check your brachial. Those seem to be strong and equal bilaterally. And then checking your radial. Also strong and equal bilaterally. Okay, put your hands like this. Capillary refills less than 3 seconds, so your circulation and perfusion seems to be good. And then can you hold or show me grip? Perfect. Strong and equal grip as well. And then for your skin, I don't see any edema, and skin is warm to the touch, okay? So next, what I'm gonna do is your lower extremities. So looking at the same thing, I don't see any discoloration or any edema. You're able to move your legs okay, so that looks good. While I'm here, I'm gonna check your pulses. So your popliteal, strong and equal bilaterally. Your posterior tibial, strong and equal bilaterally as well. Your dorsalis pedis, strong and equal bilaterally. You're in your capillary refill, pretend your socks are off. Strong and equal bilaterally. Now can you press above my, perfect, and then down on my hands? Perfect. So your strength is very good here. So now that I finished that, your mobility seems to be perfect. I'm gonna take off my gloves and wash my hands again. And now we're gonna move on to your cardiac, okay? Have you had any heart problems?
No.
Okay. So I'm gonna watch my stethoscope. Now looking at your cardiac area, I see your chest is symmetrical. Oh, thank you for putting that for me. I see your chest is symmetrical. The rise and fall chest expansion seems to be normal. Touching here, I don't see any palpations or feel any palpations. No masses, no deformity. Any tenderness?
No.
Okay, perfect. Now I'm gonna go ahead and listen to your heart sounds. Starting with your aortic, which is gonna be on your right second intercostal space. That sounds good. The predominant sound that I'm hearing is the S2, which is your aortic. Next is gonna be your pulmonic. So the predominant sound here is also the S2, which is in your left second intercostal space. Next is gonna be your tricuspid. That's in the third left intercostal space. The S1 and S2 sounds are equal. And then for the mitral, it's gonna be in the last one was Erb's point. This one's a tricuspid. There's a fourth left intercostal space, and the S1 sound is more predominant. And then lastly is gonna be the mitral. So here it's at the left midclavicular line, and the S1 sound is more predominant. Now I'm gonna listen to the apical pulse for 1 full minute.
Sorry about that.
Okay. Perfect. So your heart sounds great. Your apical pulse is just like the vital signs that we had earlier, which is 75. Now, I didn't hear any heart murmurs. In case I did, I would ask you to lay on your left side, and I would listen to all of those same cardiac sounds with the bell of the stethoscope, but I didn't hear any murmurs. Oh, so lastly, we're going to do your abdominal sound. So if you can lay on your back there for me. And have your shirt up, thank you. So just as far as inspecting goes, so far the abdominal looks symmetric. I don't see any distension, any skin lesions, any tubes or ostomies. Are you experiencing any problems with your abdominal?
No.
Okay, perfect. So now I'm gonna oscillate here. the, aortic bruit, so it's gonna be 2 inches above the bell, 2 inches above the belly button. I don't hear any bruising, which is an abnormal sound, like a whooshing sound. So now I'm going to oscillate your bowel sounds in the way that the stool passes. And I hear bowel sounds in each quadrant. If I did not hear any, then I would listen to each quadrant for 5 minutes. And those would be considered, that would be considered abnormal. And then for, next I'm gonna go ahead and percuss. So I'm gonna do this about 2 to 3 times in each quadrant, checking for tympany. If I feel anything, any dullness, that'll be abnormal. All I feel is tympany in all of your quadrants. And then lastly, I'm gonna do light palpation. Please let me know if you feel any tenderness.
All right.
And the light palpation is gonna be 1 to 3 centimeters. Anything?
No.
Okay. And then for deep palpation, I would do 5 to 8 centimeters. So far, everything seems good. So you can go ahead and lower your shirt and just sit up for me. So that concludes our assessment. Everything you passed with flying colors. Do you have any questions or concerns for me?
No.
Okay, perfect. So I'm just gonna pretend that you're in a bed. I would raise the side rails. I would lower the bed to the lowest position, have your call bell in reach. I'm gonna go ahead and wash my hands, and then I will chart everything that we did today. And if you have any questions, just hit your call button, okay?
All right, thank you.
Thank you.